In today's video, we are going to learn about how to read a prescription. A prescription is a written order by a registered medical practitioner, usually doctors, that authorizes a patient to be issued with a medicine or treatment. Decoding a prescription may be difficult because doctors generally use Latin abbreviations and medical terminology that are not decipherable by the general public. Hopefully this video might help you on how to decipher the basic terms on prescription. Let's take a look at the first example. In this you can see the first thing is Rx. Rx comes from the Latin word recipe, meaning to take. It is a part of superscription of a prescription. Superscription means heading. Next to that, we can see the patient name and date of birth. And sometimes the address is also given. Also, the patient information such as the weight, age, and gender may also be given. So in this example of prescription, the diagnosis of the patient is high cholesterol. So the medication given is Zocor 10 mg in strength. So the next thing is medication and strength or dose. For the medication, generally generic name or brand name is used. If the brand name is only used, the physician will indicate no generics. Zocor is a brand name which helps to lower the blood cholesterol. Right next to it is the strength or dose, 10 mg in this case. Oftentimes, the exact strength the physician prescribed may not be available, so the pharmacist needs to dispense the appropriate alternative. For example, if the physician prescribed Methimaz 10 mg and the pharmacy has only 5 mg tablets, pharmacist will dispense 5 mg tablets and adjust the amount, that is 2 times per day. Next thing you see here is 1 tab, POQHS. Here 1 tab is the amount. PO is the route of administration. PO means by mouth. QHS is the frequency of administration. QHS means at night. So this means that the patient has to take Zocor 10 mg tablet by mouth at night every day. Many frequencies, that is how often a person should take the medication. So the frequencies can start with the letter Q. Q is from Latin word quack, meaning once. For example, QHS at night, Q2H every 2 hours, QS as much as needed. QD means once daily, but it is forbidden to use this abbreviation since JCHO banned it. Instead, the full term daily is used instead of QD. We'll discuss about this at the end of this video. Next is disp 90. This represents how much medication to be dispensed to the patient. Here it is 90 pills for every day. That will be about 3 months. So this part basically indicates how many pills or bottles or inhalers to be dispensed. Next thing is refills. How many times the patient can use the same exact prescription, which in this case is 0. That is most likely your doctor will check your blood cholesterol and then decide on the medication. At last, there will be the signature of the physician and the date. Let's take a look at another simple prescription. Here again, the patient information comes first, then The lisinopril is the medication, 20 mg dose. Lisinopril is used to treat high blood pressure and also heart attacks and many others. So 1 tablet BO daily means the patient has to take 1 tablet by mouth daily and dispense 30 for 30 days. Refills 3 times. Next, we are going to learn about an important abbreviation used in prescriptions. PRN stands for pro re nata, which is a Latin word that means as needed. Here, the timing of administration of the prescribed medication is left to the patient or nurse or the caretaker. There is no fixed schedule. It should only be taken at the prescribed dose only when the situation arises. Next, we are going to take a look at some of the forbidden terms or do not use list of abbreviations created by the JCAHO, Joint Commission on Accreditation of Health Organizations, in 2003. For these abbreviations, doctors must write the full word and not abbreviations on any prescription or medication-related documents. First one is U, which means unit. It's usually mistaken for 0, 4, or cc. IU, international unit, mistaken for IV or 10. QD or capital QD or QOD, which means daily or every other day. No trailing zeros. Doctors must write out 5 mg and not 5.0 mg. Lack of leading zeros. Doctors must write 0.5 mg instead of just 0.5 mg. Next thing, MS, MSO4, MgSO4. It must be written as either morphine sulfate or magnesium sulfate, as they can be mistaken for each other. These abbreviations are absolutely forbidden to use, and some others are there which are in the do not use list. So it is always best for the physician to write medical instructions fully on a prescription so that the safety of the patient is optimized.